is Melanie Goldfarb. I'm an endocrine surgeon. I'm the director of the Center for Endocrine Tumors and Disorders at Providence St. John's Health Center and a professor of surgery. I've been performing thyroid RFA for just over a year and a half, and I've done probably over 60 cases so far. I really thought this would be a great addition to my practice as well as the field in general, so that not everybody would have to have surgery. One of the things I love to do is teach. I actually have 8 fellows with me at any given time and have always had teaching as part of my career since I went into practice. I think it'd be really great to help teach more people to do RFA, and I think it's a really valuable and important option for the appropriate patients. After a patient and I have agreed that this is their course of action, I set them up for their day. I have a nurse call them a few weeks before just to go over the procedure. I tell patients their procedure is going to take anywhere from 30 minutes to a little over an hour, and I generally have an idea beforehand based on how big the nodule is, how long it's going to take me. The day of the procedure, they come in, they sign their consent form, they take their medicine, and then we get them set up in the room. Before I ever start a procedure, I do a new baseline ultrasound so we can get some baseline about what we're doing, mark out the patient, then get them all prepped and draped and go from there. Oh, and of course I have them pick music that they want for the room. My patients are all awake because it's very important to get feedback from the patient that their voice is okay and that they're not in pain, because the procedure shouldn't actually hurt. Patients ask if radiofrequency ablation is dangerous, and I tell them not at all. The risks are extremely rare. You can have very rare complications. Pretty much all of them are fixable. I have found this procedure to be very effective. I've done more than 60 cases and I've had more than a year follow-up for a number of patients, and pretty much everybody's been very happy. Pretty much everybody has had that at least 50% decrease in volume, whereas many patients have had a lot greater, 60, 70, 90%.
Hi, I'm Myia Villanueva, and I received RFA with Dr. Goldfarb in early 2022 on the diagnosis of a benign goiter and thyroid nodule. I tried medication first to see if that could get the nodule down. It didn't make any difference at all. I was waiting for a very long time for an alternative method. I really didn't want to lose my thyroid. Surgery is a really, really big deal for me. Then I met Dr. Goldfarb. I did a little bit of research online. I was like, there has to be another way. I looked around a lot of people, and something about her I just loved. I had a good feeling about it, and so I made an appointment to meet her. The procedure's honestly so easy. I think I was an hour in there. After my procedure, I did my follow-up with Dr. Goldfarb 3 months later, and we'd already seen a 53% shrinkage, which is massive. And now I'm living so much better. I have more energy. Even my neck looks better. I'm feeling great. I'm gonna do a checkup. If I need to go back in and we need to shrink it again, we can do a second round. So that's easy. I know what I'm doing now, and life is good.